It was a shock to realize I have cancer. We've had cancer in the family, but all of a sudden, I got the cancer.
In a short period of time, my PSA test went up 10 points.
I finally went and did the biopsy. There was some cancer in there.
And he said, you know, there's cancer in 5 of the 6 sections.
I didn't want to ignore this problem. Another problem is if it gets outside your prostate, then you've got a whole different set of problems.
I liked my urologist, who first person discovered it, you know, but he was pretty much, there was one method, and that was the one method, was the surgery.
When somebody finds out that they have cancer, their first reaction is, oh, I got to cut it out. But when they cut it out, what are they leaving themselves open for? They're leaving themselves open for incontinence, no sexual activity. It's not a good risk-reward type of situation.
Well, there are lots of options available, and when you talk to him about what you want to do, there's a whole bunch of them. It's kind of overwhelming.
Radiation would have been, I think it was 7 weeks, 5 days a week, you know, radiation.
So many other things, procedures. There are quite a few drawbacks to them afterwards.
Since it was seemed to be fast spreading, that I would consider two options and two options only. The first one being the HIFU option, and the second one being the seeds option.
So I started, you know, checking out all these different possibilities of prostate cancer. And one of the possibilities was HIFU.
I saw Dr. Lazar, and I thought, you know, hey, this is a possibility, you know, that maybe this is, you know, maybe a good option.
I chose HIFU because it seemed to be the best alternative for me. It left me with less risk of having any problems because of the surgery, and I felt that was the greatest chance of having success.
HIFU is not something new. It's been used a lot in Europe and Japan.
HIFU was less invasive than all the other options.
When I first saw Dr. Lazar, I found him to be very thorough in his explanation of the whole process.
I liked his bedside manners, really nice guy, and explained things very well, and very responsive. I call up and I get a call, usually that same day within a short while, sometimes from him, sometimes from his nurse, you know.
I would call Dr. Lazar on the phone, and he'd call me back every time within a few hours.
We felt very lucky that Dr. Lazar was local, somebody, you know, was like an hour away, and be able to contact him.
I've had, maybe 4 urologists, and I have to say I was most comfortable with Dr. Lazar.
And there's a certain, in any profession, you have to keep yourself up to date.
He seemed to, know exactly what he was talking about.
I am a scientist, a technical man, so I tend to trust people who know what they're doing.
Both my wife and I felt like here was somebody we could trust.
One thing that's very important is it's outpatient. I came out and was doing everything I normally did the next day. But the proof is in the numbers, how good the result was.
HIFU surgery was really fantastic. It was, I went to Puerto Vallarta down in Mexico, and at that time, the procedure was not certified here in the United States to be used, but it was in other parts of the world, in Europe, in Canada, Australia, Mexico. And so I went down there, and we actually had a vacation. The procedure was actually a piece of cake. You know, I went in at 7 o'clock in the morning to the hospital there, and at 5 o'clock I was walking on the beach.
I did it in San Francisco, so you went down there the night before. And we got there, and it's very quiet, and in comes Dr. Lazar, and waited for the rest of the staff, and they very professional. They take me into the operating room there, and pretty soon I was asleep, and the next thing I knew, I was awake several hours later, and my girlfriend was with me, and she drove me home.
The HIFU surgery was a piece of cake. What can I say?
Well, we chose to have the treatment done locally, and I really liked that I could just go to San Francisco to have it done. We didn't have any problems. I mean, we stayed at a hotel down there. We walked over to the clinic.
It was outstanding. Had a wonderful dinner that night in the restaurant. Good night's sleep. It was good.
I came out of it, and I had absolutely no pain or discomfort. Still went about my normal life, you know, walking around, you know, getting out of the house, maybe the next day, not that day.
But gradually, after a few days, I started taking short walks up and down the neighborhood there. Your life is pretty much normal.
No repercussions so far. You know, I seem to be doing fine. No lasting effects at all.
Frankly, I can't tell any difference now than before I had it.
I'm going to say I'm pretty much back to pre-operation, the pre-HIFU now.
I feel pretty much normal, the way I did before the procedure. You start out at 5.1. 5 is kind of the threshold number. Now it was less than the detectable amount, so it's 0 is what it looks like to me.
And after 8 years now, my PSA is 0. I have never, since this surgery, it's always been 0.
He informed me that it was non-detectable, and that was very reassuring. And that was over 2 years ago, and it's been non-detectable ever since.
I think everybody has to go through the research. They have to find out what they're most comfortable with.
The biggest benefit for me was lack of risk compared to the other procedures, which would be radiation, chemotherapy, surgery.
I think I would be a much more crippled individual with other forms of treatment.
I do hope that my experience can be the experience of other guys.
Been a positive experience on the whole. So far, the outcome is something that you hope for.
It's been exactly as Dr. Lazar described it to me.
There's very little worry involved in it. Once I did the procedure, I was absolutely convinced after the PSA tests and so forth that the cancer was all gone.
I would suggest people talk to Dr. Lazar. Anybody who goes through this has to consider all the different options, and they should consider Dr. Lazar and HIFU, because it's just a treatment that I think is beneficial, minimally invasive, and very effective.
And today I'm virtually, as you could see, I'm pretty active for my age and can do a lot.
You know, every day it seems like, you know, did I even have cancer?
I became really aware that life is pretty finite here. Now that I've had this diagnosis, I look at life a lot differently. It's look in the paper, all the obituaries, people dying younger than me. I mean, it's made me focus a little different on what I want to do with my life and stuff.